years. So, so the life expectancy is 55 years. I remember many of my uncles, they retired at 55. In 1 or 2 years, I was attending their funerals. Poor guys hardly enjoy pension. Today, they work 30 years and take pension for 30 more years. Literally different. Today, the life expectancy is 72 for men and 77 for women. Right? So, if you ask people to retire at 55, 58, it's a long way to do that. But even more significant than the life expectancy, because life expectancy is driven by this other thing called infant mortality. Now, infant mortality in Malaya at that time was called PTM, Persekutuan Tanah Melayu, or Federated States of Malaya. At that time, the infant mortality rate was about 60 per thousand. What does this mean? This means that for every 1,000 new children born, new babies born, 60 will die before first year. Right? Today, we have brought it down to 6. Alright, there are countries in the world today, maybe Bangladesh, Mali, Djibouti, a few countries, which are still on 60. Alright, so we have come to 6, 7, 8, the same as United States, same as New Zealand, same as Hong Kong, Singapore, not very far from there. So that is about the biggest achievement that we have done in the healthcare sector. Now if you look at a few other things, talk of immunization coverage. We have achieved 97, 98%, for immunization for all the childhood diseases. Okay? And then if you talk about coverage of health, now we have put in place since independence. And for this, I think the person who takes the biggest credit is the so-called Bapa Development of Malaysia, Tun Abdul Razak. He really opened up the whole countryside, with his whole district systems and everything. He brought all the amenities on a district-based system. And the health sector followed. And we started with, we had midwives clinics, which fed into health centers, into district hospitals to general hospitals. So we created this network of health facilities. So today, more than 90% of the population in this country do not have to go more than 5 kilometers to get to a health facility. All right? So this is at the grassroots, at the grassroots. Okay, meantime, we built hospitals and all that. And today, the government side has got 130 hospitals, all right, and about nearly 2,000 clinics, and we take care of, we have 33,000 beds, and running parallel, we have actually evolved a dualist health system, side by side. We've got the government public health system, and side by side we've got the private health system. Now, private hospitals, there are more than 200, but they're smaller. Government hospitals tend to be big. Our general hospital in Kuala Lumpur was built at that time to take about 900 to 1,000 beds. But at its peak, it even had around 3,000 people. Now, one unique thing about our hospital system is nobody ever gets turned away. Anybody comes to the government hospital, if there's a bed, he gets the bed. If he doesn't have the bed, he gets a stretcher. If he doesn't have a stretcher, they put a mat. If he doesn't have a mat, maybe even some brown paper. But nobody is turned away, and people are looked after. Okay, maybe not entirely to their satisfaction in terms of hostelry, in terms of waiting time and all that. But the fact remains the core business of health is taken care of. All right, so that's been going on. But in the meantime, the private sector has been developing. So anyway, what we have now, if you look at various comparisons between the public and private sectors, again talking about doctors. I joined the health service in 1967, 10 years from independence. So my career in medicine spans almost as long as the history of this country, just short of 10 years. So I've seen it all, I've seen it all. And so I think I am in a position to see the progress, to see the difficulties, see the challenges. Now, at that time when I joined the service, there were 1,300 doctors in this country. I was one of them. 1,300 for a population of 9 million or so. Today we have a population of 28 million, we have 30,000 doctors. So our doctor ratio has gone up by 30 times, population 3 times. Okay, so that shows you the capacity building. Capacity building has gone up. So of these 30,000 doctors, 20,000 are in the government and 10,000 are in private. Okay, but if you look at dentists, they're equal amount. About just under 2,000 in both sectors. Pharmacists, 3,008 in the government, 2009. Nurses, 45,000 in government and 14,000 in the private. Okay, so that gives you a mix where the human resources are. But if you look at, for instance, the load of work, government hospitals per year, admission is 2.1 million admissions. And outpatients, 42 million attendances. You know, in all the clinics that I talked to you about, health clinics, outpatient departments, 42 million attendances. By comparison, private sector, the admissions are 800,000 per year in the 200 hospitals. Hospitals are smaller, all right? And their outpatients in their hospital will be about 3 million, not counting the GPs, not counting the GPs. Okay, how much do we spend on health? We spend now, they say the national health bill is 35 billion ringgit. Okay, of this the government spends nearly 14 billion. So the rest is spent by the private sector.
That's quite a lot.
Quite a lot. Okay, so the government's expenditure through the Ministry of Health, I mean, you can add on another one or two more through Ministry of Defence and all that.
Yes,
okay, add on
their
that.
own hospitals, right?
Yeah, so you add on that. But otherwise, a lot of money is now spent in the private sector. Okay, so now you can see that what has happened is over this time, while we have improved all our health services, we deliver all this. Now the fact remains, there are not many countries that give you the kind of service that you get here in the government sector. For $1, you get anything that you need, almost up to a heart transplant if you need it. Okay. Now, all you have to say is that you can't afford it. Okay, you can choose to be a paying patient, then you pay again, you get a better bed and a better class of wards and all that. And you get your medicines, and now they even send you your medicines by post laju. Seriously, you just pay another few dollars for the courier charge, and you can get your medicine. People with diabetes and all that who need medicines on a regular basis, they don't have to keep going to the hospital to collect their medicine. They can get it supplied on a monthly basis by post laju. I mean, this kind of service, even the World Health Organization has acknowledged that Malaysia delivers primary health care, much better than developed countries. By contrast, you take the United States of America, who spends the highest amount for healthcare, nearly 18% of their GDP on healthcare, and nearly 50 million or 40 million Americans are not covered by healthcare. Right? So you can see, I mean, they really have no resource to healthcare because all of the system takes care of the people who are insured and whatnot. Whereas for us, as I said, we never turn anybody away. Including people who are not citizens and so on. There are parts of Malaysia, Sabah and Sarawak, where more than 50% of newborn deliveries for free in the hospitals are non-citizens. But we on humanitarian grounds, we take care of them. So you can see that what has been evolving now. All right. So the issue is now we have to now take stock. Now, can we continue this way? Most people believe we can't, because you reach a point where the costs are escalating. Things are changing. So unless you sort of take a stock of this, and it's very interesting. Healthcare reform in this country has been thought about since the 80s. Study after study has been conducted. And every time they want to institute something, the next election is coming. So they say, okay, let's wait. So it keeps on, and up to now we have not yet instituted a healthcare reform system, but I'm told it's coming, So anyway, we wait and see. Okay.